The first step in becoming a speech-language pathologist is you have to earn your bachelor's degree. That's usually in speech-language hearing or communication disorders. And then you go on to get your master's, which is a 2-year graduate school program. And that's where you complete the required clinical and coursework requirements. You also have to pass the national examination, the praxis. And then once you've graduated with your master's, actually in our first year, you're getting your clinical fellowship. So this is your clinical fellowship year where you're still being supervised. And then following that, you have what we call your Cs, which means that it's your certificate of clinical competence. So, as you can see from this, speech-language pathologists work to prevent, assess, diagnose, and treat speech, language, cognitive communication, social communication, and swallowing disorders in both children and adults, and in a variety of settings. We work in a variety of settings. We can work with children, so that could be early intervention centers. We could be in preschools, elementary schools, high schools, universities. And then we can also work on the medical side of things. So that could be hospitals and outpatient or inpatient, acute care. We could work at a rehabilitation center, a nursing home, private practice, in-home services, telepractice. It's just such a huge, wide variety. You can go ahead and get your clinical doctorate degree, which would be your SLPD, or you can also get your research doctorate degree, which would be your PhD. So the speech-language pathologist role on a healthcare team is to evaluate, diagnose, and treat persons with speech, language, social communication, cognitive communication, and swallowing disorders. There's a lot of myths about what we do. Initially, when people think of speech therapists, they say, oh, so you work with children and articulation and speech sound difficulties, which is absolutely true. We do that, but we do work with babies in the NICU all the way up through the geriatric population. We really find the magic in providing our services and seeing those results and improvements from our patients who work so hard. We love that we get to work with so many other people, including the clients' families, and we build those relationships, which is so meaningful to all of us.